is Sergio. I'm actually Portuguese living in Norway, and I'm a senior innovation advisor. And I do the function of EU advisor also for Norway Health Tech and the Norwegian Smart Care cluster. So it's actually instead of one, it's killing two birds with one stone, two ecosystems in Norway. We are the two largest clusters in the health clusters in Norway, and we basically vertically integrate the ecosystem. So I will focus on what Norway Health Tech does because that's where I'm employed, but I think this is very replicable to the two clusters. So Norway Health Tech is basically a national center of excellence. It's a cluster that has the label of National Center of Excellence. And our job is to basically, with having always the patients in the center, our job, okay, this wasn't supposed to move by itself. Our job is to build competence in the health sector and build the innovation capacity of our industry. So the point is that we deliver, or we support the delivery of better care. We support the creation of value in Norway and the export capacity for Norwegian industry. So to bring the value that we generate here across boundaries. So we do a lot of industry to public sector collaboration. I think Andy, I have one sentence that I recall from Finland. It's not bad. It's one sentence that I think it was a colleague from Denmark that mentioned that we're building ecosystems and destroying ecosystems. And I keep using that now.
Good. We'll charge you for that.
All right. Royalties on that. It makes, I don't know exactly what it means yet, but it makes a lot of sense, and it makes people laugh in my presentations because everybody identifies with it, right? Particularly in the research world, there's a lot of ecosystems that we try to break more and more. So bring the industry closer to the public sector and, transform a lot of the research value that we have into innovation and patient value, market value. To do that, we've created a number of initiatives that I'll come through in a minute. One of them is A-Leap. So we're co-owners of an incubator sitting here in Oslo. I think it's, if not the largest, is one of the largest health incubators, pure health incubators in the Nordics. I think it has over 60 companies now. And I think probably about 10 that have spun out of it because they have grown enough for it. We also do a lot of facilitation and opinion leading. So, the advocacy effort towards the public authorities. We're a trusted partner to contribute to the national roadmaps for healthcare. And, whenever there's a strategic decision, we're consulted and we try to bring the voice of the industry closer to the policy making. Yes, as you see here in this chart, we vertically integrate the sector. So from the smallest startup to the largest international corporation we have in our membership, passing by the largest hospitals in the country, the municipalities, the health regions, and then a range of suppliers to the industry, from a regulatory standpoint to manufacturing, ergonomics, IP. So basically, everything or all the services, all the competences that you need to research, innovate, and deploy a product into the healthcare market, we possess in our member base. So you asked me to focus a little bit on the projects that we're involved in. Mm-hmm. So I listed here the 4 running projects, the EU-funded projects that are currently running. So on public procurement of innovation, smart living environments, then we have an EDI that is focusing on AI in healthcare. And we have Invest for Health that is focusing on novel financial models for healthcare systems, on top of, I think, 15 plus nationally funded projects. We're not the coordinator on either of these. We're the initiator in several, but we are not always the best suited to be the coordinator. So we bring in one or several of our members into the project, mm-hmm. Sometimes one of them to be the coordinator. Okay. Our focus areas are on digital health solutions with a particular focus on testing. So I'll come to that in a minute. We're developing a test facility for digital health solutions together with the Oslo University Hospital and the range of partners. We have an interest in synthetic data, so we just closed the project also with Oslo University Hospital on synthetic data for specific cohorts, so clinical specific cohorts. Virtual digital twins are also an attention area, including here the aspects of cybersecurity and privacy. So we don't use the virtual twin just to model a system or a patient or an organ or whatever. We also, deal with implications on towards cybersecurity and privacy, which today are more and more, let's say, important, but not sufficiently observed every time. Remote care and then mental health are the two strategic priorities in Norway Health Tech and the Smart Care cluster when it comes to medical areas. So we're currently developing an application on mental health for adolescents, for example, to be submitted next week, stage 1. I hope I'm not competing with too many of you. We are working or planning to work or planning a consortium towards an application on synthetic data to EHI, so Innovative Health Initiative application with the deadline in January. So if any of the colleagues around has an interest or process ongoing, I'm very open to discuss and maybe join forces in that direction. The two, let's say, initiatives that I wanted to highlight, I mentioned this in Finland already, but I think the audience was not the same. So I'm here reiterating Health Catalyst. So it's a digital or test bed for digital health solutions that was created by the three health or largest health clusters in Norway. So Norway Health Tech, Oslo Cancer Cluster, and the Norwegian Smart Care Cluster. We all had our independent testing efforts. We decided to bring it all together. We have world-class biobanks and data repositories that are, very disaggregated and not necessarily well annotated. So we're making an effort to bring that all together to one platform, make it accessible for a range of partners for testing of digital health solutions. So last week we had a presentation from a colleague that has worked on a machine learning algorithm, and he killed the magic of or the charm around AI, because he said, we had a great repository, but then I spent 3 months annotating 25,000 entries in an Excel sheet. And that was what I needed to train my algorithm. So it's very nice when you have a data repository, but like we often hear, it's garbage in, garbage out. So there's a lot of effort to be put in these data repositories to make them actually useful and worth something. So Health Catalyst focuses mostly on the digital or testing of digital health solutions, also provides the industry with one voice. So instead of being a layer of complexity above the three clusters, it is a layer of aggregation. So when we speak to the public authorities, we speak with one voice for the whole Norwegian industry that is relevant for healthcare. So that has been seen as a great added value and has opened quite a bit of doors in the Norwegian landscape when we managed to speak together across the whole sector. The other initiative is then Health to Be, which was initiated by Norway Health Tech, the Oslo University Hospital, and the Oslo Science Park, where we are based. And this is a public-private, let's say, collaboration ground, where we basically share the office with the innovation unit of the Oslo University Hospital. So we managed to bring them out of the firewall of the hospital, be much more open to innovation, open to meet the industry. So the hospital has quite strict rules on how to involve industry and let them in their door behind their firewall. So what we did was to bring the innovation unit out and allow for testing and co-development, co-design to happen in our space in Health to Be. And we're currently, still recruiting partners, but you see here already, so Novartis, Soprasteria, from very different quadrants have become partners, and Kernel, Norse Feedback, the NV Mati. So from public to private sector, there is quite interesting, quite large players handling data, handling biotech, or handling medtech, that all come together and work on common problems to try and find common solutions. So these partners are then split in what we call resource groups. So we have resource groups on, for example, regulatory matters, on procurement matters. We have one on AI that just started because, you know, if we didn't have a resource group on AI, then we were out of the wave these days. So we make, you know, I like to say that we work for the members, with the members. And I think that's one of the greatest assets of our ecosystem, that we're not, you know, a player in the ecosystem. We are the glue between all the players in the ecosystem. So that's what I had to say. Maybe just a reminder that we're 3 colleagues on the EU team. So that's, you know, I'm biased here. So we're 8 full-time or 9 full-time equivalents now in Norway Health Tech. We have a range of maybe 7 or 8 in-house consultants that come in for specific advice and mentoring. And then 3 of us are focusing on our EU projects, which are quite a large chunk of our portfolio these days. Thank you.